Let's catch up with Professor Peter Collignon again to get the latest on the pandemic. He joins us from Canberra as ever. Thanks for joining us again, Peter. I wanted to get the latest from you. You've talked before to us about sewage testing to help us get a sense of the reach of the virus. Have we had much progress in that regard?
Well, I think it's happening in a number of areas like Sydney, Melbourne and my own University of Canberra. We are doing it and it's starting. We've still got probably a couple of weeks before we know we've got it bedded down and getting accurate results. And perversely, the problem we've got in Australia is we've got so little COVID, it's hard to know you're not missing it. But again, around the world, the Netherlands in particular, but Spain and France, they showed that they could detect it in sewage a couple of weeks even before they started seeing an increase in cases. And that's going to be really important for us to know that we've got the numbers down and they're staying down. And the reason it works is about 2/3 of people with COVID have it excreted in their bowel because it probably multiplies in the bowel wall. And that actually means you pick up everybody, not just the ones you've tested, because it samples the whole community. So if you need to sample everybody, including the asymptomatics, it's actually one of the best things we can do in place that seems to work from what we've found or what we've seen already overseas.
Yeah, great way, given we've done so well, just to maintain that vigilance, as you say, especially when it can pick it up so early. Now, you've warned us a lot about not getting complacent as we go into winter, into the flu season. And we've talked a lot on this program about the protesters over the weekends breaking the social distancing rules. But when we were speaking to Nick Coatsworth earlier in the week, he points out, of course, that this is now, regardless of the fact that people didn't want it to happen, it is now a natural experiment. So the data, if there's no spike in the data or there is one, it's going to tell you a hell of a lot in coming days, isn't it?
Well, it will. I mean, the one thing about the protests is they were outside, not inside. And we know most of the outbreaks are inside because sunlight and outside are more protective. But equally, I think we do need to be concerned because so many people can have mild symptoms or even be asymptomatic, particularly if you're in your 20s and 30s. And so we've done very well in Australia. We've got very low levels of transmission. In fact, yesterday we had none. And we've done that with quite severe restrictions, but not lockdowns. So, that's very good that we've been able to do that. But it's all about taking physical distancing and those measures we put in place from mid to late March that have stopped droplets being spread from person to person. Now, I'll feel better if we get to September and we haven't had an increase, but I do worry about what New Zealand's done. They've almost gone from one extreme where they've locked down everybody for 5 weeks and now are saying tens of thousands of people can go to football matches. Now, I'll be happy if I'm wrong and they don't get any more cases, but this is such an innocuous, an insidious virus that hangs around at low levels and then can spread in people in their 20s with minimal symptoms, but then gets in the older group and suddenly in a nursing home or somewhere you get a big problem. We have to be very careful. And not only that, even if we don't have it, it's so easily reintroduced from overseas. I mean, it's rampant everywhere else. And if we don't continue to do the things that stop us getting all infections, including influenza, or at least decrease our risk, we can find this can easily come back and bite us really badly. We don't want to end up like Europe or America. We also don't want to have our economy and lives paralyzed. But we've got to find a halfway point that lets us function, but actually makes the risk of the virus coming back and really going out of control very low.